So the next question is from the option gynae. Which one of the following statement is correct regarding the fetal physiology? Option number A is hematopoiesis is demonstrated first in the yolk sac by the 14th day. So this is the correct statement. So this is correct. Second is meconium appears at the 16th week. So this is the wrong statement. Meconium appears by the 20th week. So by the 20th week, meconium appears. So this is wrong statement. Then the breathing movement are identified at the 26th week. Again, this is the wrong statement. Breathing movements are not identified by 26th week, but by the 11th weeks only. So by the 11th weeks only, breathing movements are appreciated. Then is from the fetal pancreas secretes insulin as early as 20 week. No, it is by as early as the 12 weeks. So that's why the first option is correct, that hematopoiesis demonstrated first in the yolk sac by the 14th day. So again, for the next time, the other options can be asked, like to remember that meconium appears by 20th week, breathing movement by 11th week, and insulin by the 12th week. Now coming to the second option. Which one of the following are the advantages of state of hemodilution during the pregnancy? So there is a state of hemodilution during pregnancy. So what is hemodilution? That during the pregnancy, the plasma volume increase by about 40 to 50%. By 40 to 50%. And RBC mass increase by 20 to 30%. So since the plasma volume increase is more, so the increase in the plasma volume is more than the RBC mass, so this produces a physiological anemia or the hemodilution. So this is the hemodilution. Now the question is being asked that what is the advantage of hemodilution during the pregnancy? So the first statement is optimum gaseous exchange between the maternal and the fetal circulation due to a decreased blood viscosity. So this is correct. Because of the hemodilution, the blood viscosity will decrease, leads to placental blood flow improvement, which leads to utero-placental perfusion improvement. So this is beneficial for the maternal or fetal exchange. So the first option is correct. Now coming to second, it is protection against adverse effect of supine and erect posture. So this is correct. Why? Because during the supine position there is a reduced venous return, and during the erect posture or standing there is venous pulling. So the expanded plasma volume acts as a buffer against these two changes, and so the maternal circulation tolerates postural changes better. So second option is again true. Coming to the third, that is it is protection against adverse effect of blood loss during delivery. So this is one of the most important advantages. At term, the plasma volume are markedly expanded. So therefore, the normal blood loss during the vaginal delivery or be it the cesarean section are better tolerated by the female. So third is again correct. So the correct option will be first, second, and third. So the D, 1, 2, and 3. So all the options are correct. Now coming to the next question. Let's consider the following statement regarding the oligohydramnios. So first is it is defined on ultrasonography when maximum vertical pocket of the liquor is less than the 5 centimeter. So this is wrong. So the maximum vertical pocket of liquor, which is known as the single deepest pocket or SDP or maximum vertical pocket or MVP, this is not less than 5 centimeter but should be less than the 2 centimeter. So the normal is 2 to 8 centimeter. So 5 centimeter will come into normal one. So on ultrasonography, it should be less than 2 centimeters so as to be called as the oligohydramnios. So first is wrong, because at the place of 5, it should be less than 2 centimeters. Now coming to the second option, it is defined ultrasonography when amniotic fluid index is less than 5 centimeters. So amniotic fluid index is calculated by dividing the uterus into 4 quadrants and then calculating the maximum vertical pocket in each of the quadrant and then adding them. So it is saying it is defined ultrasonography when it is less than 5 centimeters. This is correct. So whenever it is less than 5 centimeter, we call it to be oligohydramnios. So amniotic fluid index, when it is less than 5 centimeter, we call it as oligohydramnios. When it is from 5 to 24 centimeter, we call it to be normal. And when it is more than 24 to 25 centimeter, we call it as the polyhydramnios. So in this, second is correct, first is wrong, so answer will be the B, 2 only. Now coming to the next option, that which of the following are the correct regarding endocrinological changes in the normal pregnancy. So first is there's increase in the level of maternal serum iodine, second is increase in serum level of the corticotropin releasing hormone or CRS, then third is the increase in serum level of aldosterone, and then the fourth is the increase in serum level of ACTH. So first option, let us see, increase in level of maternal serum iodine. So this is false. This is wrong statement. What happens that in pregnancy, renal blood flow increases, and so GFR increases, and so renal iodide clearance increases, which leads to decrease in the maternal serum iodine, number 1. Number 2, during the pregnancy, more iodine is transferred to fetus. So as a result, the maternal iodine stores of mother decreases, and so iodine requirement increases. So the first one is wrong. There is no increase in its level of maternal serum iodine, rather it is decrease in the, so it is the decrease in the level of the maternal serum iodine. Now second is increase in the serum level of corticotropin releasing hormone. So this is correct. That what happens that near the term that the placental, that in the placenta also release it. So placental corticotropin releasing hormone, it progressively rise, and it peaks near the term. So it also plays an important role in the timing of the labor. So second is correct. Third is increase in the serum level of the aldosterone. So pregnancy activates, the RAS system, renin, angiotensin, aldosterone system. So there will be increased renin leading to increased angiotensin 2 leading to increased aldosterone. So why is it happening? So this aldosterone will help in retaining sodium and water, so that the maternal plasma volume can increase, and we know that this leads to hemodilution. And in the previous questions we have discussed that what is the advantage of hemodilution in case of pregnancy. So third is again also correct. So third is correct. Then there is increase in the serum level of ACTH. As we have discussed, that placenta releases CRH. In the second option we have done this. So CRH will increase. So when the corticotropin releasing hormone will increase, it is going to the pituitary and it is going to increase the ACTH. So in pregnancy ACTH increases, and so also cortisol increases. So fourth is also correct. So the correct answer will be 2, 3 and 4. So iodine will decrease, and other than that CRH will increase, ACTH will increase, cortisol